Good evening and welcome. I'm Zita Strickland from Pacific Science Center, and I will be your host for tonight's virtual Science in the City talk. Thank you so much for joining. We really appreciate you taking the time to connect with us this evening for this event. Tonight's Science in the City will be recorded for later viewing on our YouTube page, and there you can find all of our past Science in the City talks. For example, on the theme of travel, you can rewatch our recent Mars surface exploration in celebration of NASA's Perseverance rover safely exploring the surface of Mars. And you can learn about the science of Climate Pledge Arena in advance of the Kraken's first season this coming fall. All of these Science in the City talks can be found on our Science in the City page on our YouTube playlist. In addition to these past Science in the City events on our web pages, you can also find activities that can be done at home or in the classroom, and you can find information about our live and interactive virtual field trip programs. You can learn more about all these programs at pacsci.org. Now, we've offered this event to you tonight for free, and thank you to everybody who's made a donation at the time of registration. If you haven't yet and you were able to, we suggest a $20 donation for tonight's event. Your donation helps to ensure that curiosity never closes. For information about donating to Pacific Science Center, please visit pacsci.org/support. I'd like to start tonight's event by welcoming you all to what promises to be a very informative talk at a very interesting time. So this evening, we're only 2 days away from April 15th, when all people age 16 and older are eligible to receive a COVID-19 vaccination here in King County, Washington. SeaTac Airport recently had the most number of travelers in a single day since the COVID-19 quarantines began. And for many businesses, families, and individuals, and perhaps even for some of you watching, travel plans are being made, or you're at least dreaming a little bit more about your next trip. But travel has its own set of COVID-19 related challenges, from being in a crowded terminal, to sitting by strangers on a plane, to navigating the COVID-related requirements at your destination. And so tonight's panel of experts are going to help us sort out the known from the mystery, and are also going to give us a unique peek into not just the passenger side of travel, but also into how airlines are navigating this new world of flying in the age of COVID-19. Now, throughout tonight's talk, you can share your questions to our speakers tonight by adding it directly to the YouTube chat box on your screen. If you don't see a chat box, it just takes a moment to make a free YouTube account so that you're able to enter and leave your question for us. Now, I don't have my next flight planned just yet, but I love hearing what others are dreaming and thinking about. So if you have a trip planned or a future trip you're dreaming about, please add it to the chat. I want to see the places you all are going. As you do that, I'm going to introduce some of our guests tonight and also give you an overview of tonight's program. We're going to start our conversation tonight with a refresher on COVID-19. This is going to be with Dr. John Lynch. John has a master's in public health and is a fellow with the Infectious Diseases Society of America. He's an associate professor of medicine at the University of Washington School of Medicine here in Seattle, and he's an associate medical director at Harborview Medical Center, where he oversees the hospital's infection prevention and control, antimicrobial stewardship, sepsis, and employee health programs. Since January 2020, John has led the UW Medicine COVID-19 Medical Technical Team. He's also worked at the local, state, regional, national, and international levels on the COVID-19 response and chairs the Infectious Diseases Society of America COVID-19 PPE Guidelines Committee. Outside of UW Medicine, John has worked with Alaska Airlines, the Port of Seattle, Vertical World Climbing Gyms, and the NFL on developing safety protocols for COVID-19 prevention. John, welcome so much. I'm so glad that you're here tonight to help us get to the bottom of everything that we know about COVID and what we need to know about travel. Also joining us tonight, and after a review of COVID-19, we're going to learn about how one airline has managed the related operational challenges and changes of the past year. For this, I'd like to welcome Jeremy Horn, Director of Security for Alaska Air Group. As Director of Security, Jeremy works to ensure the aviation, corporate, and cargo security of employees and guests of Alaska Airlines and Horizon Air. This is no small feat, as Alaska Air Group services 115 locations, including in Canada, Mexico, and Costa Rica, with a fleet of over 250 aircraft. Since February of 2020, he's also led future planning for Alaska Air's COVID Group's COVID-19 response task force, ensuring employee and guest safety throughout the pandemic. Jeremy has nearly 35 years of experience with active duty Air Force Reserve, and the Washington Air National Guard. He has a Bachelor's of Science degree from the United States Air Force Academy, a Master's of Aeronautical Science from Embry-Riddle Aeronautical University, and is a commercial multi-engine pilot with over 3,500 hours of flight experience in fighters, trainers, and civilian aircrafts. Jeremy, thank you for joining us tonight.
Thank you, Zaya. Great to be here.
Now, lastly tonight, we're going to learn about what all of this means for us as a future traveler and what we can expect on our next flight. And so joining us for this is Charu Jain, Senior Vice President of Merchandising and Innovation for Alaska Air Group. Now, in this role, Charu provides leadership for the strategy and execution of employee and guest-facing innovation for the company. She collaborates with the commercial team, the operations divisions, and the technology teams, where she oversees the implementation of technology and processes that drive forward momentum around growing revenues, defining guest interaction, and employee experience and innovation. Prior to her work with Alaska Air Group, Charu held roles at United Airlines and worked across industries, including with IBM and PwC as a thought partner and a change leader, successfully in leading large-scale transformations and scalable technology solutions that have enabled dramatic business efficiencies, service delivery, and customer satisfaction. She has a bachelor's degree in economics and an MBA in international management, and also has a passion for developing STEM talent, working with Year Up here in the Puget Sound area and the UW Foster School of Business. Charu, I think all this innovation has probably helped you quite a bit this past year, because it has been innovation from one side to another. So thank you all for joining us.
Thank you. It definitely has been an interesting year.
It has. So we're going to start tonight with the medical side of COVID, and then we're going to explore how science and technology have supported these operational changes in airlines with a focus on Alaska Air Group. And we're going to learn about what this means as a traveler for us in the coming months, and how airlines are working with destinations also regarding requirements. Now, for everybody watching tonight, throughout this evening, you can put your questions and your comments in the YouTube chat, and I'll share these with the guests throughout. If you have a question for a specific person, you can include their name right there in your question. All right, let's get started. We've got a couple of people in our chat who are planning some trips, hopefully Thailand next year and Napa Valley this summer. And so as we're thinking about these trips and these travels, John, let's start with you. There's been a lot of changes in the year with our knowledge about COVID-19 transmission. I know many people a year ago were wiping down groceries. We've gone from no mask to single mask to double masks, eye protection. So let's just kick off with a refresher. What is it that we now know about how COVID-19 transfers from one person to another?
Yeah, thanks, Zeta, and thanks to Pacific Science Center for putting this on tonight. I think it's a great, and I'm looking forward to a great conversation. So I'm an infectious disease doctor, so let's just lay some groundwork here. So the virus that causes COVID-19 is called SARS-CoV-2. So that's the pathogen, the germ that causes this problem. The disease that it causes is COVID-19, coronavirus disease discovered in 2019. And we've learned both a huge amount and recognize we have still a ways to go. The reason I really want to highlight the classification of this particular virus is that it's a respiratory virus. It is a virus that moves from one person to another person through what we call respiratory routes. Now, back in the spring, as you mentioned, people were again wiping down, mail, wiping down their groceries, wearing bandanas. People recall the Surgeon General a year ago showing us how to make masks out of t-shirts. What we've really recognized and has really been updated by public health authorities, including the CDC, is that the main mode of transmission for this virus is respiratory. So through respiratory particles ranging from very tiny to fairly large, some that float, some that don't, between one person and another person. Those particles land on our faces, in our mouths, in our nose. We may inhale them if they're very small. We may even get them on our hands and then touch our eyes, nose, or mouth. Regardless, all of that has to do with respiratory particles. And what we've really learned, and I think most recently has been, again, with some guidance from the CDC, is that all this concern about surfaces probably isn't nearly as important as we once thought. So the issue of things like everything from an armrest to groceries to mail. So just to give you some personal experience, when I bring the mail into my house, I don't let it sit for a couple of days. I don't put it aside. I go through it basically how I normally go through it. I do wash my hands. As an infectious disease doctor, I'm actually thinking about lots of other diseases out there, lots of other infections that aren't SARS-CoV-2, that aren't COVID-19, that triggers me to wash my hands a little bit more often than probably your average person out there. I'm also lucky to be married to a nurse who keeps my whole family honest around preventing all kinds of other infectious diseases. The other thing that we've really learned is that COVID-19 really has a spectrum of presentations, of clinical presentations. Someone can have COVID-19 and have minimal symptoms. Someone can have COVID-19 and very severe symptoms. And what we've really seen is that the most severe symptoms are occurring in older folks who have a much higher risk of disease progression. But that doesn't mean that no one else. I'm not a pediatrician, so I'm not going to speak too much to the kids, but we do know that although children get COVID-19, very few of them do poorly, although some do. Enough people get infected, as unfortunately has been the case in the United States, we're going to have some of those issues arise. But in general, as we get older, our risk of having worse outcomes is definitely impacted. I do hope to talk a bit about vaccination maybe later during this conversation, but we're definitely starting to see the impact of that in hospitals like mine, within UW Medicine, and many hospitals across the country, where we're seeing older adults who are getting very sick and end up in, for instance, ICUs in our hospitals. That's not really happening. And we're starting to see sort of a disconnect between the number of cases, the number of people being in the hospital, and the number of people who are dying from COVID-19. And I attribute that really entirely to the vaccine effort. So there's some quick hot topics around SARS-CoV-2 and COVID-19.
Okay, so I actually would love to just dive right into some vaccination conversation now, because it really is increasing quite a bit. I was just looking today at the CDC website, and it looks like 36% of the US population has received at least their first dose. So that's over 122 million Americans have that first dose. So should I just wait a couple months before I plan my first trip? Will it all be over then after the vaccines have reached a high enough level? Can I throw away my mask in July, I'm asking?
Well, I think when this all started kicking off in January, we're looking at a much longer sort of trajectory. We thought that the access to vaccines was going to take a lot longer. And it's actually moved along pretty quickly in very positive ways. And I think that's, in part being driven by the demand. The manufacturers are really doing a great job. Also, from the White House and CDC and even Governor Inslee really, really pushing all of us to make these vaccines available to everyone as quickly as possible and in the most equitable way possible. Really, really important part of that. We have run into a bit of a challenge today, as folks probably saw in the media, the issue around the single dose Janssen or J&J vaccine, this question of an association with some types of clots. Fortunately, the CDC and FDA and others are going to be having an emergency meeting tomorrow to look at all the data. And so that's on hold. I'm really very hopeful and optimistic that we're going to be able to get that vaccine back into action very, very soon, because that's going to be a really important part of it. But in the meantime, the Pfizer and Moderna vaccines are doing great. And hopefully we can continue to expand access to those as well. The other really good news is they're starting to see some of the data come out from the manufacturers and researchers around kids. Some very promising data in the 12 to 15-year-old population. Again, there's no reason to think these vaccines won't work great in them as well, but we really want to see the science. Just like we saw when we rolled out the other vaccines. We want to hold the manufacturers to the same level of rigor so that when we start vaccinating our kids, it'll be as safe as we know it will be. And so, I think we're going to have that data by late spring and early summer, and hopefully get access. So I'm really looking forward to a late spring, early summer, widespread access to vaccination, which is going to be a huge deal. It's the way out of this pandemic, to be honest.
Yeah, and that has a really nice correlation to, I think, when people are traveling the most also is in that late spring and into that summer. Can you speak for a moment about some of the variants that we're hearing about too? Because we've have this COVID-19, we've developed these vaccines, and now there's these variants. And I was recently reading that in some places, we almost have more cases of the variants than of that original strain. So how are vaccines and variants tying in together?
Yeah, so there's a bit of good news and a bit of bad news. So you're right. So that we do have these variants. All of what are called variants of concern is classified by the CDC. These are variants that are more transmissible, may have some way to escape some, but not all of the immune response for people who have been infected before. And the biggest issue is they infect more people more quickly. These are kind of expected, unfortunately, for folks who are in my part of the world. When you infect this many people with these types of viruses, or called coronaviruses, mutations are going to happen. And some of those mutations are going to lead to problems like more transmissibility, maybe more serious disease, maybe less serious disease. And so one of the key things here is that we're going to continue to see variants of concern until the globe has access to vaccination. Those are going to continue to arise. So that's one really important equity issue around this. There's no part of the world that's disconnected from the other parts of the world. But how are the VOCs, the variants of concern, playing out here? Well, unfortunately, as expected, we see them. Pretty much all the ones we know about and the CDCs are alerting us to are present in Washington State. We really thought that the strain from the United Kingdom, first described there, also known as the B117 strain, was going to land here and then was going to sort of start to ramp up very quickly, like it did in the UK and other parts of the world. Interestingly and sort of surprisingly, a different variant from California that was also more transmissible. There's actually two strains, the 1427 and the 1429. I know the nomenclature is terrible, but that's where we are. Actually, we're close to California here in Washington State. That got up here and actually started to kick off a little bit sooner. And right now, those two are sort of they're in a tie, each holding about 30% of the tests that we're doing. And those tests, those sequencing tests, are not perfect sampling. So it's the best guess we have. But right now, those two together are probably about 60+% of all the strains we're seeing. And they're sort of tied neck and neck. And we're going to continue to see it. And I just want to emphasize that as we think about those variants, right, we, to some extent, are, the downside to doing so well in Washington State around all the restrictions that we've embodied, all the masking, all the distancing, all the things that we've done to keep our community safe, means that most people in our state are not immune, right? And until they get access to vaccination, that means that they can get infected by those variants. And so it's really, truly a race. And just to final round this out, your initial question was, how do the vaccines work against these variants? They work great. They're not, it's not as awesome. And I'll just tell you, these vaccines are astounding in their efficacy and their effectiveness, better than we possibly hoped. And so they prevent death, serious disease, hospitalizations, even moderate disease in many people. Fantastic. And it's maybe affected, particularly in sort of the South Africa strain and the Brazil strain, a little bit more, but still extremely effective. And just to give you some context, when we think about influenza vaccination, we're happy with a sort of 45% effectiveness year. These vaccines, even for some of those variants of concern like South Africa and Brazil strains, we're talking, 85, 90%. So still phenomenally effective.
So super effective, but it's absolutely global and worldwide. And Jeremy, and Charu, I'm thinking of the two of you when John is describing this like entire world connected, because as a company whose job is to connect people from location to location, a worldwide vaccine or a virus like this really is hitting your business pretty close to what you do. I'd love to just ask you, when this all started, this was probably on your radar as professionals of a travel group before I was on a lot of the average people in the United States radar. What was that like, that first initial response and getting connected to somebody like John, who I know you've been working with now for over a year? And I think you said recently you haven't met in person yet, or maybe just once. It's all
One
been
time.
virtual. So yeah,
John and
how
I,
was that at the beginning, that connection?
John and I sat at the table in late February of last year. We had just received word of the first confirmed case in Washington State, and shortly after that, we received word of the first death. So one of the smartest things Alaska did was latch on to John and his counterpart Chloe, and also the CDC, to really narrow down our information to some credible sources, because you could have gotten whiplash chasing all of the different theories and conspiracy theories, even at that time, of what this virus was and was not. And so we narrowed it down to what's the science that we know. And quite frankly, nobody knew a lot. And so everybody was kind of making some of it up as we went. And so initially we were very, very concerned about the impact of international travel. But as a primarily domestic airline, we thought, okay, we can ride that out. It'll be something that looks like bird flu or Ebola, that it'll probably stay someplace else and won't impact our operation. And unfortunately, within just a couple of weeks, we found out that no, this is going to be globally game changing for every airline in operation. And actually, I'd like to turn it over to Therese, who was probably involved in a lot more of the upper level business decisions than I was.
You're still muted, Charu.
That has to come up on every call, right? Somebody is muted speaking.
At least once, I think. I'm going to check that off with my Zoom bingo right now.
Gotten it out of the way. Our business dropped 95% on a single day. So I think, for us it was very much a Houston, we have a problem kind of a moment. And then very rapid, actions had to be taken, like Jeremy said, to understand what is our impact. How do we control our costs and bring the business to something that can survive, and then work on sort of the longevity of the business and then recovery from all of the impacts of COVID. So it had a very big effect on our business, and safety became top of mind. It was always about, where do we fly to? If we fly there, people will fly us. If we have the right price, people will fly us. And that didn't matter anymore. You probably could pay people to fly, and they wouldn't if they didn't want to. So it all became about safety and taking care of our guests.
So I think that is a great transition to just learn a little bit more about how you made that change to, hopefully as an airline, safety is always an important aspect, but this is safety on a whole different level, on individual behavior as well as the technology. So let's start a little bit with just some of the considerations that you had in listening to the CDC and talking with John and thinking about how do you bring science and technology into play to make sure that just being in the cabin of an aircraft is safe in terms of lowering transmission possibility?
Right, that's a great question. And as John mentioned, initially we were very focused on, I'm going to use a fancy word, fomite transmission, the touching and maybe absorption through the skin, maybe through the eyes. And so we took some great measures to up our aircraft cleaning. Normally on a quick turn of an airline, pre-COVID, the cleaners would just go through and make sure that all the trash was picked up, maybe do a little vacuuming if there were animal crackers on the floor, and that was about it. Now we actually stretched the schedule for that ground time out so that we could have them wipe down individual trays, and we invested in spraying machines for electrostatic spraying and things like that. So we were very focused on that touch risk, and also because that was what our customers expected. If you got on an airliner and you were already nervous about being sick, the last thing you wanted was to flip down your table and see a Diet Coke ring on there. And so we wanted to make sure that visually it was very appealing and comforting to our people as well. But then we really started looking at what's the impact of the air. And if you're seasoned, as I am, you might remember that you used to choose whether you had a smoking or no non-smoking section on an airliner. And I think that's the perception that a lot of flying public has, is that air just continues to flow throughout the cabin for the duration of your flight. And that's actually not the case. And we actually partnered with Boeing and Airbus, as well as Embraer, and to Helen, the manufacturers of our aircraft, to really investigate what's the filtration like, not just the equipment, but how does the air flow. And we also brought in Harvard University and the Department of Defense. Both helped with some studies that kind of validated externally this is what happens. And so what we found is that air volume changes over about every 2 to 3 minutes in all 4 of the types of airplanes that we fly. And the air flows from the ceiling straight down to the floor. So it's almost like a curtain that is, if someone is shedding virus, the bulk of that is going straight down and into the capture. And then some of it's going through a HEPA filter, which is a sort of a medical grade filter. And a lot of it is being replaced from air from outside, which at 36,000 feet, there's not going to be a virus there as well. So we were able to use that and take that information and a whole bunch of others. And we really focused, this isn't about marketing, it's about safety early on in the response. We wanted to keep our employees safe. We wanted our guests safe. We wanted our guests comfortable. And then we figured, in order to make our employees and our guests comfortable, how do we tell that story of all the different things that we're doing? And I think that's where Charu would appropriately take over for our next level care.
Sure. As Jeremy spoke about sort of the air filtration and the cleanliness of the planes, we did a couple of things. We stepped back and looked at the entire guest journey as they come into the airport, as they interact at the airport and in the airplane, and focused all of our efforts on making it as touch-free as possible. So when we looked at every time you have to touch something like a kiosk at the airport to check in or get a bag tag, or you have to exchange a document or a credit card, or you have to be in close proximity to another person, like an employee. So how can we make all of those experiences feel safe, along with the cleanliness and the air filtration on the flight? So everything started with the mobile app, the Alaska mobile app. So you can check in for your flight and you can pay for your bags on the mobile app. So when you get to the airport, now you need a bag tag. And so you don't have to touch the kiosk at all. Not the screen, nothing. You can just use your boarding pass that you have on your mobile app and scan it, and it'll print as many bag tags as you need because you've already paid for it. Let's suppose you needed to talk to an agent to check in your bag, or you had some questions. The agents can now text your boarding pass to you. So again, you're not exchanging a boarding pass, or email your receipts to you, or use your stored credit card for payment versus really exchanging that credit card. And then as you're boarding, now the boarding pass can be scanned from 6 feet away. So that gave you that safety that, you're away from the employee, you can be away in line. There were social distancing stickers at the airport, like the 6 feet wingspan stickers that we worked with the airports to put. So you didn't have to get close to an employee to scan your boarding pass, and you could keep yourself and the agent safe. When you are on the flight, we reduced a lot of our food and beverage service, because initially it was not clear how much time it's going to take, or with a mask or without a mask, what element of risk does that add? But you can now pre-order what you want. So there's ahead of time you indicate what you're going to eat, and then you store a credit card on file, which you may have with Alaska Airlines already, or you can add it. And then as you're given that food or drink, you do not have to take your credit card out. So you don't have to reach out in your pocket. You don't have to go across other customers that are sitting and give that. So it was really all about, like, how do we not just look at the plane, but look at every part of that experience and give that comfort to people about safety and the distance that they needed, and I'm not touching things, I'm not exchanging documents. And so that was on the, I would say, on the technology side of what we did. The other thing was really, in terms of our relationship with our guests, I would say the pandemic was a huge disruption. So, we were all about care, but it all became around safety. That became the most important thing. And lots of things were changing, as you heard from John and Jeremy. One day it was about cleaning, the next day it was about testing, and then about masks. So we really wanted to make sure that we were meeting people where they are or they were. And so how do we give them all of the right information at the right time? And so we created this messaging platform called Next Level Care. And it's really where you can go and get all of the information that you need. It has every, what's going on, which destination you want to travel to, what are the limitations, or what do you need to know if you want to get tested, what do you need to know, what about hand sanitizers, what about masks, what's our mask policy. And it was really Next Level Care was the way we wrapped up everything so that people had one place to go to.
Can I just riff on a couple of comments that Jeremy
Yes,
made
please.
that I think are really tied together nicely as things evolved? One was Jeremy talked about this work that Boeing did. One of the most interesting conversations I had last year in a year of very interesting conversations was a conversation I met with a group of Boeing engineers who basically did these amazing modeling experiments. These are the Uber engineers, like the real deal folks who know how air moves, how to measure air movement, how to look at particles in space and on the ground, as well as in aircraft. And they were able to develop a model where they looked at how the air is being ventilated, moved around each aisle. So just one thing that Jeremy didn't mention was each aisle has an air delivery and exit. So each series of seats has that sort of like little bit of window, that kind of curtain of air. And so what they were able to model with thinking about aerosols early on was that there was sort of not real, but because of the airflow, a kind of a calculated distance. So the distance between you and the person in the row in front of you or behind me may be measured in feet. But when you actually calculate it using the airflow, it was like being a dozen feet away, as if you're outdoors a dozen feet away, which was remarkable. And I think just attests to the level of air movement within airplanes. And I'll just say that the number of air exchanges, that's what we call that in infection prevention, is something like we see in an operating room in a hospital or even higher. And the filtration is the same that we would use in an operating room. And that's what's running on airplanes continuously. And
that's not new. That's not a new circulation system that has existed before COVID.
They've had those air exchanges for a long time. Mm-hmm. And so that technology's been there. But I think it was really cool how the Boeing folks in the cooperative that Jeremy mentioned were able to say, hey, this is the way air truly moves and how aerosols may be either contained or constrained within a specific site. And the data is fantastic. I look forward to them publishing that or putting it on YouTube someday. It's really cool.
Yeah, my inner data nerd really wants to see that map of airflow around different seats so I can start using that when I pick my own seat selection for my next flight.
To see them sort of nerd out at that level, it was like nth level exponential nerd. It was just glorious to watch as a fellow nerd.
Amazing.
The other part was just, again, thinking about distance and what Charo mentioned. We've been doing all these touchless things and thinking about, as Jerry mentioned, the fomite, the surface as a thing that can transmit. What we're learning now is that that's probably not as big a role. CDC saying that fomite transmission, surface contact, is a low risk intervention. But what we did do as part of that was what Charo mentioned, but I really want to emphasize, is that we actually created distance between people. And that's, we know, is still really important, right? The perfect way to stop COVID-19 is everyone stands 20 feet or 50 feet apart forever, right? We'll have no COVID-19 transmission. But we're humans. We come closer, we have jobs, we travel, we do things. And so all of these steps we take are around mitigation. But trying to reduce that, how close you get to people at the ticketing counter, asking questions, bag check, it's not the fomite thing now we've learned, it's the distance that's probably the most important part of it. And again, and I'll touch base on this a little bit later, is one piece of many pieces from the time you leave your house to the time you get to destination and back that are really the keys to preventing and mitigating transmission risk as we travel.
Yeah, unfortunately, if we want everybody 50 feet apart, we're going to have much bigger airplanes. And that's been an evolution for us as well, and sort of a balance of the safety versus the business aspect, in that initially we didn't have any trouble ensuring a whole bunch of spacing on the airplanes, because I remember flying in April or May of last year, and there were about 3 people on the airplane. It was eerie. And as consumer confidence started growing a little bit and we started putting more people on the airplane, we committed until April to block the middle seats. And I'm not 100% sure how scientifically effective that was, but it was a confidence builder for sure. But really, as the data kept coming in through this Harvard and DoD study and others, and just anecdotally looking through research, there's really nothing to show that there, even pre-mask policies, that there was a super spreader event on an aircraft. Now, one of the things we were very sensitive to is your behavior once you arrive on our airline safely is probably going to be a greater impact to a community than actually being on the airplane itself. And so what we did do was suspend service to some particularly remote villages in Alaska at the request of their local government. They said, hey, we need to get a hold of this, so please stop flying in, and we respected that, and we did that. And only when the science was really evolved and we developed some better mitigation strategies did we start restoring service to that. One of the things Charu just mentioned as well is culturally we had a shift of our people, particularly our flight attendants, our customer service agents. They come to work at Alaska because they like working with people, and they have great smiles, and we are known. That's really why we have such a loyal customer base, is because we have such friendly employees. And that's one of the reasons I actually came to work with the company. I flew them as a consumer for decades, and I thought, if I'm going to go work someplace after the military, I want to be someplace that people like being there. But then really within the span of a couple of months, we turned them into the enforcers of a mask policy. And they've handled that with grace and aplomb, but there's a fatigue there as well. So if I leave nothing else with our Pacific Science Center audience tonight, on behalf of all the airlines, if you're going to get on an airplane, please just wear your mask. It's not that hard. My 3-year-old granddaughter does it for an entire flight from Florida to Seattle. So we have proven that mask is the most significant thing that we can do to stop the spread. And so when you get on an airplane, it should be a commitment that our house, our rules, you're going to wear your mask for the duration of your travel.
Yeah, and in a little bit, I definitely want to get into some of that psychology and how do you make the decisions that are going to have such a big impact, across your entire customer base, like having a mask policy. We've got a couple of questions that have come in from the chat, as well as some comments that I want to touch on. First off, Brian would like to give a kudos to Alaska for continuing to maintain an open center seat and good spacing between passengers. I am not a center seat fan myself, so I love not having those center seats available. And Lucas has a question about some of the topic of surfaces. And I really like the evolution that you've talked about like first that we were cleaning surfaces, but it's really more about the mask wearing. And my last flight actually was on Alaska, and it was in early March. It was about 4 days before everything just stopped. And as I was headed to the airport and thinking, not sure if this is a good idea, I had my little packet of cleaning wipes that I had gone to 4 stores to find. And I was like, well, I'm going to feel silly, but when I get on the plane, I'm probably going to wipe down surfaces. And I got on the plane and it was a quarter full and everybody was wiping down surfaces, but it was early March and none of us were wearing masks. So there's that interesting just evolution of what we know and what the behaviors are going. Lucas is also thinking about that topic of surfaces and asking if you can just touch a little bit more. It's not really transmitting through surfaces, but if people aren't wearing masks in grocery stores or in hotels or a gas station, then what is that risk that impacts and imposes when others are touching that same surface that you've been touching? And John, you're muted.
Yep, of course. It was my turn. Charo handed off the mute button to me.
I know to watch Jeremy next.
Jeremy, you're up. So I'm not sure I understand the question 100%, but let me give it a go. So 2 things. One is indoor versus outdoor. That's the other thing that we've really learned over this last year is the sort of the infinite dilution outdoors makes a huge difference. Remember back in the spring and summer, we were wiping down everything, right? Because that was something that you could control, right? As a passenger, as Alaska, you could electrostatic spray everything all the time. 100% under your control. It gave you confidence as a, as an airline. It gave passengers confidence. The other thing you remember here locally in Seattle, and this is true across the country, we shut down parks.
Mm-hmm.
In retrospect, what in the world were we thinking? Being outdoors is probably the best possible place for people to be, because those aerosols, those small respiratory particles, those droplets, either fall to the ground or get diluted and don't lead to transmissions. So I feel, really pretty comfortable around being outdoors in spaces. It doesn't mean gathering in large groups, not yet, right? We're still in the pre-vaccine phase for most people. And where you have large groups, you have clustering. People get close together. They start spending a lot of time together, and large groups together. So not quite there yet, but I think we can get there in the future. The other part of this is that we spend a lot of time cleaning surfaces, and what I'll just tell you is wash your hands. Washing your hands is actually even better than wiping down every surface that you think you're going to touch, because you just don't know what you're going to touch. And what's going to work really is a combination of the technology that Charu mentioned, all of that touchless stuff. I was just down at CTAC recently, and you should see the bathrooms these days. They're spectacular. You don't touch anything. You just, use the restroom, and then at the sinks, everything it's like, really 21st century. And then you're performing hand hygiene. And behind all this, that's really, really interesting and is worth probably a Pacific Science Center talk in the future is, when we think about the future, I'll just tell you, we're not seeing people with flu at all. We've had no children die from influenza. We've had no older adults in the ICU because of influenza. In Europe, we're not seeing enteroviral meningitis. We're not seeing human metapneumovirus and other respiratory viruses in people getting with cancer and chemotherapy. What we're doing is having a huge impact on other respiratory viruses. And that's why I was being so careful about using that word early. SARS-CoV-2 moves around like flu, or moves around like rhinovirus, which causes colds, or many other viruses that can cause anything from the sniffles to very serious diseases in other people. And we've interrupted transmission of all of those through the things that we put into place and are continuing to use right now. Masks, distancing, hand hygiene, and staying home when you're sick. So I'm not sure if I answered Lucas's question. Lucas, hit me up there if I didn't do it.
Perfect. Thank you. Yeah. And AJ was also thinking about, and wanted to ask you, John, about the ripple effect, whereas flying might be more safe, but when people travel, they're just interacting with a lot more people, airline workers, tour workers, in the hotel and restaurants. Can you speak a little bit to that, just that whole ecosystem of travel, not just the part on the plane?
Yeah, so this is actually really important, and I think is actually intrinsic to the work that Alaska has done and the Port of Seattle and CTAC has done. So when we think about, let's just think about the travel part, and then we'll tackle sort of the end, the destination. So when we think about the travel part, what we're really thinking about is a whole series of steps. And so I'm going to just quickly show a graphic, if that's okay, just to give you a quick snapshot. So for those of you who are super interested in or have expertise in flight and other sort of similar level organizations, they're familiar with the Swiss cheese model. This is basically a model that says that you put in a whole series of steps to mitigate, to prevent bad things from happening. In this case, virus transmission. And what's really important is there's no single step that is sufficient to block off 100% of a negative outcome. Again, in this case, infection. This is a really great graphic, taking that Swiss cheese model and putting it into the context of COVID-19 transmission reduction or elimination. This was put together by a guy named Ian McKay. He's a fantastic virologist in Australia. He sort of crowdsourced this on Twitter, and I really, really like it as a great way to capture this. And it also speaks, as I mentioned, to the airline folks. And so you see on the left, virus, on the right, a person. And there's a combination of a whole bunch of steps. There are some of which are personal responsibilities and personal steps, like Jerry mentioned. Some are shared responsibilities. And so you can see, like on the very far left, staying home if you're sick, right? Wearing masks, hand hygiene and cough etiquette. Don't cough on people. Wash your hands regularly. Avoid touching your face. If in a crowded situation, try to limit your time there. Then there's other ones that are more shared: access to testing, ventilation that we just talked about, support for folks in businesses that are being impacted, using things like quarantine and isolation through public health. And then lastly, see vaccines, which again, I will emphasize, have holes. Vaccines are not 100%, even fantastic ones like this. But by lining up a whole series of mitigation steps, you can really effectively and safely prevent transmission of COVID-19, of SARS-CoV-2. And so when we think about the air flight, we're talking about if you wake up in the morning and you have a fever, that's a signal that it doesn't matter whether you have a ticket. And, Alaska has put in, and other airlines have put in mitigation steps to help you with that if that happens. But you really shouldn't be leaving your house, right? You need to go get COVID-19 tested and stay home. And if you have to go out to get that test, wear a mask while you're doing that. When you get to the airport has put lots of ventilation steps into place. As Charu mentioned, they've got stickers on the floor to create space in the waiting spaces. They have dedicated spaces to eat. You see TSA is still wiping down all of the buckets you put your stuff in. They've put up a lot of barriers and they're all wearing masks. And that goes into touchless bathrooms, the cleaning of the STS, the train in the airport, right? The air handling and the ventilation there has been improved, and the filtration. And that's just to get you to the door of the aircraft. And you think about all the steps on the aircraft, and then the same things are happening at the airport. I would like to just quickly and briefly, we talk about it quite a while, is our responsibility, that's shared, or the personal decisions we make when we get someplace. And I'd really look to Jeremy and Charu's discussions on this as expertise, their expertise in air flight and travel. But, my expectation is that the way you act at home to keep your personal community safe is the way we should be acting when we arrive in that destination. We should be, it's about compassion and it's about respect, and I've only heard through like social media and some media accounts about, for instance, people living in Hawaii, like what their expectations are when people travel there, right? They want to be treated with respect. They don't want COVID-19 transmitting there. That means masks on people. It doesn't mean, hey, you got a test, now you're in Hawaii, no holds barred, masks off, do whatever you want, go to parties, right? They really expect you to act as if that's your home as well. And I'm sure that's true throughout the country. And so that's what I would say. Treat everybody and every place as if it was your home. And that's probably something my parents taught me when I was young, and I think probably holds true for lots of other activities. I don't know. Jeremy, Charu?
Yeah, John, you bring up a great point. And I was saying, as we were getting the conversation started before the live feed, my wife and I have continued to travel, but what we do at the destination has changed. And I think that's true for a lot of our guests, in that we're not going to a resort, we're not going to a concert or out to dinner. We have an Airbnb that we've rented. We rent a car. It's just the two of us. We make one quick stop at Costco to stock up on enough food for a long weekend. And then the rest of the time we're outdoors. And so our behavior has changed to be more responsible to ourselves and to those around us as we get there. And honestly, that's one of the great things, not to be completely parochial about Alaska Airlines, but the fact that we don't rely as heavily on business travel and on international travel actually has us in a fairly encouraging position compared to some others.
And I think, it's been no surprise, but flights to national parks were the first ones that came back with guests traveling on them, because I think people wanted to get out, but they wanted to be outdoors and feel safe.
I also wanted to address one aspect of the previous question. So we've kept very, very intensive records on our own employees, on how many employees have tested positive for COVID, how many that have then subsequently we've asked to quarantine through our own contact tracing processes. And we have literally thousands of employees that we've asked to contact trace, and very, very few of those have asked to quarantine due to contact tracing. Very few of those, like less than 1%, have actually subsequently become COVID positive. And by the same token, our employee case rates against our population are actually lower than the national and really the state averages in the places where our people live and operate. And so really a lot of that comes down to not only the Swiss cheese approach, but also the expectations we've put of our workforce of, we're going to give you some safety tools, we're going to give you equipment, we bought plexiglass for the lobbies, we have suspended service, we've done all of these other things to keep you safe. Now it's on you to make sure that your behavior lives up to that, and our employees continue to do that, and we're very impressed.
And roughly how many employees do you have to understand sort of the scope and scale of that tracking and employee support process?
Right. We have about 23,000 employees, and of that, we have just a few over 1,000 who have tested positive throughout the course of, and this is all the way back. We started tracking back in, I believe, the second week of March was the first positive case that we had, and so 1,000 out of 23,000. Of that, we've probably quarantined another 5,000 or so, and so we've been very aggressive about notifying people, making sure that leaders are informing their people and equipping them to do the right thing, stay out of work for initially 14 days, now 10 or maybe 7, but we made it easy for our people to do the right thing and stay home from work if they were exposed or if they were feeling.
Mm-hmm.
One of the remarkable things just about that is that when you look at the scientific literature, the reports of outbreaks that have occurred on planes, it is remarkably few when it comes to airplanes. Given the tens of millions of people on planes, to see so few transmission events reported it's actually quite remarkable. It's even lower than I would expect. And anyone can look up on literature searches just looking for numbers of these types of transmission events, and it's a handful. And with again tens of millions of people on planes, it seems to be working quite well.
Well, I think that really speaks to that Swiss cheese model of there's so many different things, in approach to really mitigate that list or that risk of happening. Brian actually has a great question regarding the mask expectations. And that Alaska and airlines do have very clear mask expectations. But Jeremy, I think this is for you. From a security perspective, how is Alaska, and you can speak to other airlines as well, being proactive with people who won't wear a mask?
I apologize if I missed something. I think my internet dropped out for a minute there, so it sounds like I came back in just in time. And masks are the real convergence between my job title on my business card of Director of Security and really what I've been spending about 80% of my time on, as has John, I think, of COVID. And so we've really got a graduated approach that we want to educate first and foremost. And so everything from when you book a ticket to your pre-travel communication, it all points to here's our mask policy, and has been really since we had a voluntary policy starting in June, actually probably May. And then when we went with a mandatory policy in August, and now we have a federally backed, TSA policy. And so the escalation of that, at any time any of that has changed, including what type of mask is acceptable, we make sure that we first and foremost educate. And then once they get to the airport, we have layers of reminders. And initially it's just a gentle reminder, and then it becomes a little bit more forceful. And we've empowered our employees to prevent an unsafe situation, which we see somebody continually without a mask, whether it's in the airport or on the airplane, as risking the safety of those around them. And so if it's a repeated behavior on the ground, we've empowered our employees to say, sorry, you're not flying today. We'll book you in again tomorrow. If they get on the airplane and they close the door and we're ready to go flying, and they still continuously, despite warnings, continue to not comply, we have a yellow card, which was I think a brilliant marketing stroke to equate it to our sounders people. But to give them that, saying, this is your final warning. Our mask policy is on the card. If you didn't understand it before now, here's your last warning. And then after that, if they continue to not comply, we have a process where we are going to not allow them to fly on our airline for the duration of our mask policy. And we review each of those. But as of today, we have 480 over the course of 7 months that we've now said you're not allowed to fly in Alaska until we no longer have a mask requirement. And honestly, 480 out of the millions of passengers we've flown since August, I think we have a 99.996% success rate with that, which indicates that our employees are doing a wonderful job of educating and reminding.
Yeah, that's a really small list of people ultimately after 13 months now of this.
But some fairly entertaining stories. Sorry, Chair.
I bet. We'll save those for another talk as well.
I think, Zena, you had mentioned sort of how do you make that decision, right?
Mm-hmm.
And the federal mandate has just come about recently, but I think airlines looked at this as something that was needed. Initially, it was all about cleaning, and then we don't need a mask, and then it was around masks help keep you safe. And airlines were considered essential services. So, our employees were flying, and then there were people flying, our guests were flying. So what was the best way to keep them safe along with the cleaning and air filtration was really wear your mask. And so this was, as airlines in the industry, we compete, but on things like safety, we come together and collaborate. And all airlines came together and really made that decision to say, no, we're going to mandate wearing masks so that we can protect our employees and protect guests that are flying. It kind of goes back to that personal and shared safety in that Swiss cheese model, to say you need to take steps, and then you have a responsibility to yourself and everybody around you. And our employees, I think that the yellow card, it really gave our employees kind of that feeling that they had some teeth to this, so that they could use the card and it would really be acted upon, versus just complaining a few times, which they don't like to do because they love the guests that are flying. But it really gave them that teeth and that power to say, I can make a difference and protect others around. And that's then noticed by other guests, right? To say, no, this is a serious thing. And even today, I was traveling back, and somebody must have complained about something, and management leaders from our airline met that person and had a discussion with them and to find out what actually happened, and then took the appropriate steps to either say, we're not going to be able to fly until you do these things. So it's a very serious affair, and that was even before it was federally mandated. It was, again, that responsibility and accountability, putting it back on everybody to say, you need to do your part.
So Charu, and talk about everybody needs to do their part. And at the start of your last answer, you were talking about how all the airlines were really working together. And we pretty much at the exact same time had a comment come in from Amanda asking, are there other examples of where the different airlines compare and how the policies compare? So for example, Amanda's asking, how does Alaska compare to, say, Delta or United or some of these other airlines regarding things like open middle seat or the mask mandate, or changing food and order and beverage services?
Yes, great question, Amanda. I would say that, in terms of kind of the in-flight environment and the cleanliness was what everybody went after, right? So making sure that we had enhanced cleaning procedures, and people would feel that cleanliness and communicate to people, your plane is clean and you can now go in. I think, Jeremy, we even have a certificate right on the plane as you enter that it's been cleaned. This collaboration on the mask was a great one. I think as far as seats and blocking middle seats, I think all airlines went down that path, and over time, based on their demand, how full they were, and pressures on the airline from a business point of view, I think different airlines took it off at different points in time. But it was, again, the mask, it's again, all of these things helped. So the cleanliness helped, the filtration when people understood it helped, the mask wearing helped, So it's all of those things happened for us to be able to say it's okay to now occupy that middle seat, because you have all these other factors. As far as food and beverage on the plane, again, we didn't know enough initially. So it was, let's avoid as much as possible and take service out. And I think each of the airlines has been introducing it slowly. For our process, I know, and Jeremy probably knows the most about this, we have a safety management system. As part of that, we do safety risk assessments. So even when we say we're going to offer coffee, we do a safety risk assessment. Does that mean we're going to have more contact or more people like time together, or it's going to take longer? And we use that process to go through introducing any kind of food or beverage in the cabin back to make sure that we're taking safety into account. So each airline has their own process, but everybody's starting to bring service back, because when you're on a flight to Hawaii and it's a 6-hour flight, not having anything, is really tough, and people are bringing their own food, right? So you still have that risk of people taking off their masks and eating and drinking. So how do you do that in a safe way? By giving them those options.
Sarah brings up a great.
Going through each of those, I've never gone through every single different before last year. Go through every single different menu option with the team that's in charge of that, and thinking about everything from Can you have a can versus having it in a cup? To, thinking about now you have to dispose of two things versus one thing that was in someone's mouth, to warm nuts, to cold meals versus warm meals. Just for those who may be big Alaska aficionados, I did not know how passionate people are about the warm nuts. It's a very, very important part for many people. But, then you have someone who's snacking and their mask is down. And so I have to say Alaska, and I'm sure other airlines too, have been really, really thoughtful about every single step, every option to try to mitigate and make it as safe as possible, while also trying to figure out how do people, eat and get nutrition and drink water and other liquids as they're on these long flights. So it's been a very interesting journey.
That was John, a question from the chat that came in actually about how do you balance that people in close proximity having to take their mask off to be able to eat and drink.
Well, yeah, and John, you broke a lot of hearts when you told us to discontinue the warm nuts. So we're just now getting over that, but we're hopefully approaching that point again. And so, yeah, we very clearly have again educated the traveling public, and this is straight out of TSA's guidance of if you're going to bring your mask down to eat or drink, it's cover between sips and bites, and so unfortunately we see people trying to abuse that. I remember I was on a flight before the TSA mandate, and the guy across the aisle from me pulled out a bag of sunflower seeds, and I'm like, this is going to be a long flight. And I finally had to confront him and say, that's not the intent. And he wasn't very happy about it, but he complied after I kind of called them on it. One of the things Charu mentioned that I think is worth highlighting is our safety management system has really led with this, and it's a way that we take what's the severity of the risk and the probability that it will happen, and we can match those together and figure out what level of risk that is, and then what mitigating circumstances we can put in. And we conducted over 250 individual risk assessments for different elements of COVID, and that resulted in almost 1,000 different mitigating techniques. Some of them are next level care. Some of them are, like now, can we bring back the selling alcoholic beverages in the coach? It's a great business decision. We really want to be able to do that. Our customers want it, but we also need to make sure that we understand what the unintended consequences might be, and that the benefit outweighs any risk that we would have for our employees or guests. So now, as we're starting to unwind some of these, we're already anticipating. We know we're not going to have masks forever. We know we're going to be able to restore service. We know we're going to be able to start reducing distancing at the airport. What are the triggers? What kind of guidance do we need to understand is coming in order to anticipate that? So no kidding, the minute CDC says you no longer need to wear a mask, we want to get rid of that policy and get back to flying with a smile on our face.
Are your middle seats currently open, or are you now booking this?
We are booking middle seats now, yeah. I think Delta was the last holdout, and they are, I believe, on the 1st of May, so they only have another week or so of empty middle seats as well.
Mm-hmm. And so I imagine that was one of the risk analysis you were just talking about, thinking about what is the consequence and what does that mean? Are there other things? I imagine that some of this innovation that you've created, you're going to keep into the future, because it's great for the flying experience in general, and some you're going to be rolling back. Can you give us any more examples of some of the things that are just a COVID now that might go away at some point, and some of the calculus of that? And then later I want to ask you about some of the things that are here to stay. But for now, what other changes can we expect as things roll back?
Charlie, that sounds like your lane right there.
I think, our employees do such a great job working with our guests. So anything that separates the two, we want to get rid of that. So, so that masks, right, so that they can smile and see each other and acknowledge each other, and that distance. So I think things that are really helping sort of, make people feel safe are like masks and all, hopefully, like, John and Jeremy had said, are going away. But there's a lot of things. I'm going to jump into what's going to stay. There's a lot of transformation that's happened, that's accelerated in every industry that we look at. And when I look at, contactless or touchless and payments, right? I don't think anybody wants to whip out their credit card anymore, because it's so easy to be able to just have it and then use it wherever you need. So that's something that I definitely think that's going to stay. Anywhere where we've taken friction like out of the process and it's easier for you to do something, you do it all in one place and then you can enjoy the journey. I think those are all things that are going to stay as we move forward.
I think one of the things we're going to try and get away from eventually is electrostatic cleaning as well. There's not a ton of evidence that it's very effective. It was very visible and it made for a great TV commercial and video of people doing that. But what we're also finding is in some instances it's damaging some of the fixtures of our airplane. Some of the plastic is becoming discolored, and so we've had to try and change cleaners. And at this point, I think we're kind of thinking we're not sure the juice is worth the squeeze on that one. And so instead, physical contact and having our people wipe a tray table down, I think that's going to endure, just because there's a new expectation that when you flip it down, crumbs don't fall out.
Yeah. One other thing I would bring up, Zara, is, fresh food. And there was a lot of waste because we would have a lot of meals and then you didn't know how many people were going to order or take. And we've gone to all pre-order now. So for fresh meals, you pre-order it and then it gets delivered to you on the plane. And I think that has reduced so much waste in the environment. So being a sustainable, environmentally friendly company, I don't see that going away. I think that's been a great output.
What are the warm nuts coming back?
I don't think we've done the risk assessment yet.
Didn't we start Hawaii service today with some hot food? So
I believe we did. We did. One of the things we're very eager to get back, and we've actually already started the risk assessment process on, is the recycling on board. Prior to COVID, we actually led the industry in recycling. I think 2,000 tons per year that we were keeping out of the landfill. And because of the safety concerns and the exposure time in the aisle, we've stopped doing that. But I think we're going to get back to that fairly quickly.
So John, as an infectious disease expert, what are some of the changes that you're seeing now that you would advocate stay in the industry and just in people's personal habits?
Well, I mean, I think that a lot of things we've just already talked about, some of which are, I think, going to stick with us and some of which would be a little bit harder. So, I think that the airlines have been very, very flexible around allowing people some flexibility in their schedules, so accommodating those illnesses. I'm not a business person. I can't speak for Alaska or anyone else, but I assume that comes at a cost, but I don't know. I think so that's something I could see being a challenge. I think, the masking, I fully see that eventually going away at some point. I really do think that the vaccines are going to have a huge impact and allow us to normalize and get into this new normal. I think all the touchless stuff that was just mentioned, the distancing, all the things you can do to reduce friction are going to be, better and better. I love the idea of being able to pre-order and reduce waste. We just talked with some of the team from Alaska today around reintroducing the recycling because, that's, again, a fantastic thing. I think that things that are going to be very interesting to sort of suss out that I don't think we've come to, finalize is how do we handle groups of people who are, like on an airline or in a stadium or in a hospital during cold and flu season. As I mentioned earlier, we've really demonstrated we can shut this down. And it's going to be very interesting. Do we start adopting practices like we see in East Asia right now? For folks who travel a lot, like Jeremy and Charu, probably have a lot more familiarity with this practice than I do. But you see South Korea, Japan, and China. The routine use of masks through that flu season, and maybe we'll be looking at something like that. I think as an infectious disease doctor in the hospital, I'm certainly interested in wearing a mask next winter, even if COVID is sort of on the back burner or really not as big a problem, because I know what impact it has. So, I mean, I think that everything that Charu mentioned, Jeremy mentioned, I think I'm in complete agreement with. I do think that this issue around masking, and I think is still up in the air. I think it's going to still play a role. And behind all that, I think the, environmental cleaning is still going to be important. And I'm glad to hear Jeremy speaking and talking about the turnover cleaning and some of the work that's being done there.
Okay, so I will keep my masks. I will not get rid of them.
Yeah, don't get
Just,
rid of the nice masks that we've all
just
bought and made, especially if they're good, well-fitting, multi-layer masks. I would keep them for two reasons. One is, someday down the road, you're going to say, you remember I had this mask back in the pandemic of 2020? But I think there's going to be great opportunities to continue to use these. And we've sort of normalized it to some extent. I personally remember the very first day I walked out of the house with a mask on 9th Avenue, downtown Seattle, and how awkward I felt. And now it's nothing. And I think that we may have turned the corner on that practice going into the future.
Mhm. So, John, I'm really glad that you talked about Asia and how many, it's so common to be wearing a mask there, which really gets us to the next question that I want to ask you in thinking about not just where we are here in Washington or being on the plane, but also destinations and where we can go. Because, you have commented, Jeremy, that you're mostly a domestic carrier, North America, but you're serving and you're connecting with other airlines that are international and it's global. Different countries have different requirements. We may even have different states have different requirements. So can you speak a little bit to destination requirements that exist in this nation and globally, and what you as an airline can do to support travelers who are navigating that?
Yeah, that's become a significant part of my portfolio is just trying to keep up with what the other entry requirements, and it really goes back to probably August when Hawaii introduced the ability to bypass quarantine by coming up with a negative COVID test. And so what we've done is we can't keep a list of everything, but we've tried to link all of our guests to as much information as we can about where they're going to fly. And now we're just recently a part of the One World Alliance. So now we're linked up with British Air and with American and Japan Airlines and all these other truly global carriers. So it does add a little bit of complexity, I guess, to that. But really, what we've done is just try and educate. If you're going here, you're going to need this, and link to the destination's government webpage or the state of Hawaii, for example. So we try and direct them to the source that if something changes, they're going to be able to find that as well. We're also looking at the possibility of, is there technology that can help our guests? And we're certainly not going to mandate that anybody downloads an app and uses it to manage not only their healthcare credentials, but the entry requirements. But we have started looking at a couple that may actually make it just smoother for the guests and for our employees.
And I would just add, I think, every airline, I think this is offered, but for Alaska, if you go to alaskaair.com, you can get a link and look at wherever you're flying, what the latest restrictions and things that are available are. It is changing, it was changing hourly at times. It's probably more daily, weekly now. And so we've created this one place that everybody can go to and learn. And then obviously as things change, and if they're changed in the short term, there's flexibility. You can cancel your flights, change your flights without any penalty.
I would just say just one other part to this, again, from the infectious disease perspective. We as passengers empower airlines like Alaska to do what we're asking them to do, right? If we wear masks, if we stay home or sick, we follow the recommendations and the requirements, right? Then we can do things. And this is a really important lesson that I think we didn't do a great job in communicating over the last year, folks, science communicators like myself, is that we can do a lot if we, wear the masks and distance, stay home or we're sick, and all those sorts of things. That allows us to do a lot. And I think we really struggled with this idea of lockdown last year as the only tool. And lockdown was then associated with masking and distancing and testing and staying home when you're sick, as just like what that all means is stay home. And what I would say, and I would argue, is that all of those tools are mitigation steps that allow us to engage more as a community, engage in work, engage in travel. And so, but it requires that we do those things. We are active in the personal decisions we make when we're on a plane. And that allows, if the more all of us do that, the more airline, Alaska, can fly, because they don't have problems. They don't have exposures. They don't have infected people on their planes. And the same thing is true globally. And I just want to emphasize this as a little bit of a departure, is that as a country, right, we are part of a global community. And we need to help get vaccinations to other countries that are still struggling, because all that travel, right, is going to be impacted globally if other countries don't have access to vaccinations. And more variants will arise. And those countries that are experiencing ongoing parts of the pandemic are going to complicate travel, right? And create challenges for us and make things much, much harder and require ongoing and more severe mitigation steps globally that could be mitigated by easy access to vaccinations. So, it's really about that being a community partner on the plane and globally, from a country perspective, that's going to really get us to where we all really desperately want to go.
So vaccines are such an important aspect to this. And vaccines really are going to help us as a global community get to that healthier level where COVID-19 is no longer the present danger that it currently is. So here's the question for you. You have a mask mandate on Alaska. Do you foresee having vaccine passports or having destinations have vaccine requirements?
Jerry, you want this one, or I can?
Why don't you go ahead? I'll add.
Okay, perfect. No, and really no airline has even seriously considered mandating a vaccine for passengers or for employees. To my knowledge, none of the airlines are mandating it for their employees. Instead, what we're doing is educating our travelers. And right now, we don't fly anywhere that requires vaccine. There are some European countries that are it looks like implementing that. So we'll work with our partners at American to figure out, hey, or British Air, hey, if somebody's flying on us from Kansas City to Seattle and on you there, how do we educate them about the entirety of their journal and of their journey? And that's a little bit of a challenge, but we're looking at that. But no, we have zero appetite to add restrictions to our passengers. We just want to educate them on what their arrival restrictions might be.
And I think, keeping in mind that we want to meet everybody where they are. Some people are more comfortable with traveling, some are not. So giving options. I think vaccine passports or immunity passports are very interesting. They'll enable people to travel more freely. I think it's very complex also to figure out, especially for international locations, like what's the standard, right? Who comes up with a standard, and how do we make sure that standard can actually be accepted in every country? And any privacy sort of issues behind that, right? So there's some thinking to be done. I think we would definitely support having that as a concept and whatever we can do to enable it. But I don't think it's something that we would we can alone come up with. This is something where, as an industry or working with the government, and even for domestic travel, I think Hawaii is looking at that now to say, if we have vaccine passports. So we'll need to work with, our destinations that we travel to figure out how do we sort of enable and communicate it to our guests, and then enable them to be able to do their travel.
I will say there is a precedent for this. For those of you who have traveled internationally, particularly South America, South Asia, and Africa, yellow fever vaccinations are required in many countries if you came from a country where yellow fever is endemic. It's not rare that this is required for people traveling to many parts of the world. So it's going to be very interesting to think about. People think, oh, it's impossible. Well, it's being done right now and has been for decades in other infectious diseases. So it's going to be very, very interesting to see how this is played out, both by commercial entities like Alaska, but I think more importantly by countries.
Well, we do have time for our audience to ask one or two more questions. So if you have a question that hasn't yet been answered, please put it in the YouTube chat. I do want to say that Charu and Jeremy, we do have some Alaska fans in our audience. People have definitely commented and appreciative the open middle seat and not penalizing for the travel changes. Pam commented that they really loved the safety dance. If you haven't seen it, you can find it on YouTube. It's all employees. Jeremy and Charu are not in it, but it is all Alaska employees. And I think speaks a little bit to their culture of customer service and what draws people to the company. So a question that I have for all three of you actually is just getting into this thinking of, as vaccines happen, as more people are traveling, what is something I'd like to hear from each of you? What's a thing that every traveler should do, either before, during, or after the air travel portion of their trip? Charu, would you like to go first?
Sure. I'm just going to go back to what you've already heard from John and Jeremy and me. It's that personal responsibility. If you're sick, don't travel. Wash your hands, wear your mask, and just do your part to keep yourself safe and others around you safe.
I agree, and I would ask that passengers understand the requirements throughout their journey. And if they disagree with a policy, don't take it out on our people. That's the most frustrating aspect of all of this to me, is that we have some amazing employees, and we have people who try and make, whether it's a political statement or a scientific statement or something, because they disagree with our policy, and it's just really frustrating all around. So understand that if you wish to travel, now there are new rules that apply, and we hope it's not forever, but it is for now, and we're serious about them.
I guess it's my turn. I would say something similar. I think we can count on the airlines, the aircraft, the airports to do what needs to get done around ventilation, distancing, touchless, separating out eating from not eating, gates, and all the other things that are going on. And so it comes back to what Charo mentioned, is that responsibility. And when I think about, don't come in when you're sick, it's like the way I sort of try to phrase it, because in UW Medicine, we ask all of our employees to check in every day. They come to work and say that they feel well. And it's a moment to just check. Hey, do I feel fine today? Do I have a sore throat? Do I have a headache? I don't really care what you write down. What I'm asking you to do is just check in with yourself. Make sure you're making the right decisions today. And it's not only do you feel okay, but importantly, were you exposed to someone with COVID-19? Did you just get a test for COVID-19 because you may have had something a couple days ago and you don't have the result back? All of those scenarios, what we're asking people to do now still and for the foreseeable future is to hold off, to take advantage of that flexibility that Alaska is using, recognize that there's going to be chances to travel again in the very near future. It could be a day later, it could be a week later, it may be a month, or maybe it's next year, but those destinations will be there. Alaska will be there. Other airlines will be there. And it's really about making that personal step to keep everyone as safe as possible in the middle of an unbelievable global pandemic.
It sounds like the Swiss cheese model is in full effect there. A lot of individual things to do, and a lot of gratitude to companies like Alaska and the Port of Seattle and SeaTac for taking on some of those organizational aspects. We do have a question that came in from the chat, thinking about on that personal side, what if you're traveling with a child, like a 6-year-old? Are there any different recommendations when traveling with a young child?
Well, I'll jump on this one. As I said,
Andrew, you almost stumped him, it sounds like.
No, as I said, my granddaughter successfully wore a mask from Tampa, Florida to Seattle. And it was because her parents, who are great parents, started working with her weeks prior when they knew the trip was coming up, and made it fun and got her cute kitty mask and did all the things to make it more of a positive experience. And we understand that it's not going to be perfect, that a kid is going to pull the mask off, and that a kid's got to have a snack and all that. And our litmus test is the parent trying. If the parent is using the child to make a statement, then we look at that differently. But if the parent is, as we all have been, frustrated that their kid isn't hearing what's coming out of their mouth and doing what they're asking, we get that as well. There's some grace there.
Excellent.
That makes total sense. Kids are doing this. We think that little kids aren't capable, but you talk to daycare teachers, you talk to kindergarten teachers. The kids, they listen. They know what's right. They want to be safe. They want to keep their friends safe, their teachers safe. And I'm sure when they're traveling, they want to keep everyone around them safe. Kids are good, right? And they generally want to do the right thing.
I have a kitty mask that I quite like. It's Cats in Space. I love to wear that one. All right, so final speed round for the three of you. You've gone through quite a year. We've all gone through quite a year. But I mean, John, you reviewed the Alaska Airlines menu from top to bottom. So looking ahead, what is something that you are curious about with the next evolution of COVID-19 and organizational and airline response?
I'm really, what I'm really encouraged by is the gradual coalescence. I mean, it feels like it's taken a long time, but it's happened actually quite quickly. Jeremy and Charo mentioned, the federal support around TSA support around masking. And what I'm seeing is increasing coalescence around what we know works, the science that works. And so I'm really hoping that we can hone in on the key things that really work and start shedding some of the things that really don't help. And I think that's like the electrostatic sprayers that Jeremy mentioned. That's probably not a big tool here. The role of vaccinated individuals, I think, is going to be a huge conversation. Even if it's not on Alaska's, their decision-making process, it's going to be something that, CDC and the feds are going to be talking about and figuring out and putting out guidance on. And, it's not just airlines, it's cruise boats, it's lots of ways that people take trips. And so I think it's going to be really interesting to see how that works. So I would say it's that gradual focus on what we know works, shedding of the things that really aren't very helpful. And I hope to see some more conversation in the near future around the real important impact of vaccination.
Charu, Jeremy, what are you curious about?
I think more than curious, I've been amazed by the pace of change that now people have become used to and been able to take on or drive. And I think there's a learning in there to say, how do you keep that in mind and sort of accelerate some of these things that in the past could take ages to get done, and then when needed you were able to move so quickly. So what is that learning, and how do we not lose that muscle to be able to drive some things in a very accelerated manner that we all look forward to?
Here. I want to second that. That is, I want to find a way to bottle that ability to move so quickly to carry us forward. Same here in healthcare, Charu.
Well, I just came out of 35 years in government, so agility is not something we were known for, but I am very much looking forward to just seeing all the smiling faces at the airport as families are getting on airplanes to go wherever it is they wanted to go and haven't been able to go for a year. We firmly believe that there's pent-up demand, and honestly, folks probably have a little bit of savings because they haven't been going out to dinner and they haven't been traveling. And so we're really just excited about connecting people with where they've been dreaming about going for the last year. And some of those dreams have emotionally and mentally gotten them through that year, that they had something to look forward to. And it's so much fun for me at the airport now, and it's going to only get better as we go through the summer to see kids with Mickey Mouse ears that are heading to Southern California, to Orlando. I think it's just going to be great to see us get back to what normal used to look like.
Well, and AJ in the chat has made a great point that it sounds like vaccinations are important. There's still individual actions to do: wearing a mask, staying somewhat distant, washing hands. John, you're probably so excited about the new interest in washing hands from everybody as an infectious disease expert. Keeping up with the CDC recommendations, but the plane part of the travel is pretty safe. You do need to think about what you're doing at your destination and what you're doing getting ready to get on that plane in the first case. So I think I'm going to go check out some of my travel books that I've been putting off, because the dream is relit with me and probably in a lot of other people watching tonight. I just want to thank all of you so much for joining us. Really great conversation and amazingly complex discussions you've had over the past 13, 14, 15 months. And thank you for making the actions such that Alaska Airlines is just a great company to have based here in Seattle. And we're so glad to have you join us tonight. John, thank you also for all your work locally and internationally on infectious disease, and may next year be a little bit easier for you and all of us than this year. I hope everybody watching tonight has enjoyed tonight's program. We would love to hear your feedback about tonight's event. So please take just a quick couple of minutes to fill out our short survey. We've put it in the YouTube chat for you to approach. And remember to sign up for our e-newsletter at pacsci.org/SITC. And you can donate to Pacific Science Center at pacsci.org/support. If you've enjoyed tonight's event, or if you just need to re-listen to a part of it again to understand it, You can share it with friends and families, and you can watch it again on Pacific Science Center's YouTube page. It will be there for the next many, many months. Keep an eye on Pacific Science Center's webpage for upcoming events. We've got some more virtual events that are happening in May into the summer, including our virtual field trip program. And we even have some spring break programs that you can still sign up for that are happening tomorrow and the next day. All those you can find on the link posted to our chat. Again, before we go, I just want to extend one more thank you to everybody who has joined us tonight, who both listening and watching and sharing some fantastic questions, and to our panel of experts who have re-explained a lot of what's happening with COVID, about what airlines are doing, and I think lighting that fire to start thinking about where that next trip is going to be. So thank you for joining, and thank you for being curious with us. Good night, everybody.
Thank
Thank you,
you.
Zeta.
Thank you so much.